Hi guys, so today we're going to talk about Parkinson's disease, which is also known as PD for short. This disease affects 1% of the population over 60 years old, so this video is going to offer some general knowledge and awareness for that population. We'll talk about what the disease is, how it might affect people, and what to expect if you know someone who is diagnosed with Parkinson's. So imagine that I've actually drawn 1,000 people here. At any point in time, 1 to 2 of those 1,000 people will be diagnosed with Parkinson's disease. Now, this typically does affect the population over 60, like I mentioned before, but early onset Parkinson's can affect people who are under 50. PD is also classified as an idiopathic disease, and this means that the cause of Parkinson's is actually largely unknown. There is a genetic mutation that's related to PD, but only about 15% of people with Parkinson's have that mutated gene. So now we'll get into more of the details about what this disease actually is. It's a progressive neurodegenerative disease, and that means that over time, more and more neurons in the brain are degenerated and lost. Now, the specific neuron that's involved with Parkinson's disease is called a dopamine neuron. And dopamine neurons are super important for making and controlling our movements. So these dopamine neurons live in the basal ganglia in the brain. And the basal ganglia is essentially a collection of structures and nuclei that all make connections with one another and end up controlling our movements. The dopamine neurons pair with certain receptors to help make these connections possible. So when our body is making movement, we say that that's part of our direct pathway within our central nervous system. But these neurons are also important to help limit movement and stop unwanted movement from happening. And we say that that is part of our indirect pathway. Without these dopamine neurons and all of the connections that are made in the basal ganglia, a person can start to exhibit some movement and bodily function symptoms. There are 4 symptoms that are more prominent than others, and someone with PD will usually experience all of these at some point in the course of their disease. People with PD might also experience depression, funky sleep schedules, memory loss, and have a hard time concentrating. There are a variety of treatment options for Parkinson's disease, but because PD is a progressive disease, treatment doesn't cure the problems someone may experience, but it does give that person a higher quality of life for as long as possible. Sometimes medication is advised for someone who has PD, and what this medication does is up the amount of dopamine neurons that are in the brain. However, this doesn't help for longer than a couple of years, and at that point, sometimes, depending on the case, surgery might be recommended. So speech therapy is a very common way of treating someone with Parkinson's disease, and SLPs can help with voice disorders, speech sound disorders, motor speech disorders, and feeding and swallowing problems that result from PD. And we will get into more of that now. So we'll start with the voice disorder aspect of PD. The human voice really reflects personality, health, age, and emotional condition of an individual. And unfortunately, a lot of those self-defining characteristics are taken away with Parkinson's disease. A PD voice disorder is a concomitant voice disorder, and that means it's a neurogenic disorder like we've previously talked about. The voice of a PD patient can have discoordination, tremor, or paralysis from hypoadduction of the vocal folds. And hypoadduction is when the vocal folds are underfunctioning and have inadequate tension to make the correct kind of sound. As a result, the voice may sound monotone, mono-loud, harsh, and breathy. Intensive therapy generally improves adduction, which improves loudness, which then improves the intelligibility. So speech therapy is great for strengthening those weaker vocal behaviors, and a lot of the time with Parkinson's, just getting someone to talk louder really helps with their voice quality. Other options for more severe cases of the disease can include phonosurgery, thyroplasty, or even Botox injections. So next we'll talk about the speech-sound disorder aspect. People with PD will have articulation problems, so they don't have a problem with phonology and processing it, they just have a problem articulating themselves. So this is why their speech can be slurred and distorted in production, and that has to do with the weakness and paralysis and poor condition from the neuromuscular deficits that we talked about before. So a lot of times in therapy, a drill-like session that builds from simple up to complex is super beneficial for these patients. So next we'll talk about the motor speech disorder aspect of PD. And the reason that the speech, sound, and voice disorders exist that we talked about just before is because patients with PD experience motor execution problems. And the motor execution refers to the processes that are responsible for activating relevant muscles during the movement used in speech production. So again, that's resulting from the disturbances in the central nervous system and the dopamine imbalance that's preventing proper functioning of the basal ganglia. Parkinson's is a hyperkinetic dysarthria, and that means that movements are going to be very slow and rigid. And because the muscles can't work correctly, that's what's going to cause those voice and sound articulation issues. So lastly, people with PD often experience feeding and swallowing problems because of that paralysis and inability of muscle function. And the outcome of this can range. It can include malnutrition, weight loss, fatigue, frustration, aspiration, and in serious cases, even death. About 30% of individuals with PD will exhibit dysphagia. And again, these problems can really range. There might be problems with oral transport with the tongue. The pharyngeal swallow might be delayed. Laryngeal closure could be impaired. Aspiration can definitely occur. And esophageal motor abnormalities can impede a swallow. And these are all really important when we're thinking about things like choking and developing pneumonia. But we also need to remember that feeding and swallowing also has a social aspect to it. And if someone's not comfortable eating with people or in front of people, that can lead to something like depression or social isolation, and those are also really important things to think about as well. In conclusion, a person with Parkinson's disease is going to face a lot of struggles and be affected in a multitude of different ways by their condition. Support, love, and patience are all very helpful things in managing this disease. It's also really important that if someone close to you happens to be diagnosed with Parkinson's, to be well aware and knowledgeable of everything that may come with it. I hope this video was able to offer some good knowledge, but of course, if you're looking for more info, check out parkinsons.org, where they have even more to offer you.